It was just last month some Twitter users had a meltdown when the Centers for Disease Control used a poppy seed muffin to show just how small some ticks can be. The CDC apologized for grossing some of us out, but it made the point that ticks can be tiny and very hard to spot. Things that can actually increase your risk from getting sick from a tick bite because you just can't see them. Dr. Nirav Patel is Chief Medical Officer at SSM Health St. Louis University Hospital and Slew Care. He's also an infectious disease specialist. We asked you to come in to talk about how to stay healthy this summer with these ticks out there. Thank you so much for being here. So we're going to show some of the different tick-borne illnesses that are out there. There are so many of them: ehrlichiosis, tularemia. Many people familiar with Lyme disease, but you say that's kind of rare here.
Absolutely.
And now, bourbon virus. What is that?
Well, so as you mentioned, there's a whole host of different viruses, bacteria, parasites that can cause illnesses that all come from the tick, and they all can have very similar symptoms. Bourbon virus and Heartland virus are two relatively newly identified viruses that all have similar symptoms: fevers, abdominal pain, a rash, sometimes diarrhea, and can have the same presentation.
But their causes are different. Some are bacterial and others are, as you say, viruses.
Absolutely.
Does that make it harder to diagnose these illnesses when you run across them in people?
Yeah, it's very challenging to make the diagnosis. You really have to think about where the person got sick, whether they got a tick bite, whether they can produce the tick and show you so you can think about what kind of tick it was. And the travel history is the most important from my perspective, because there's different diseases that are in different areas. If you're in Missouri, you're at risk for certain infections. If you're in Illinois, if you're in the upper Midwest, if you're in the Northeast, different diseases in different places.
And when I look at those symptoms, the list we had up, it looks like the flu, you know, upset stomach and maybe a fever, sometimes a rash, but not always. It's so vague.
Absolutely. And again, the symptoms, they can be very nonspecific: fevers, chills, body aches, headaches, abdominal symptoms, nausea, vomiting, diarrhea sometimes, and then the rash, which can be present, sometimes is not present.
And so you're asking if people have been outside in high grass or in a place where ticks might live. Is that how it goes?
Absolutely. So that story, the history that they provide is the most important factor. You're looking at whether they were camping, doing outdoor forest sorts of activities, what type of clothing they were wearing. Were they wearing shorts? Were they laying in the grass for long periods of time, enjoying a picnic, for example, but were more likely to be exposed.
Okay, so that leads us to prevention and how to prevent this from happening. What's the best way to do that?
Well, there's a number of things that you can do. Most importantly, I think, is just being aware of where you're at and what you're doing. Wearing long pants, long sleeve shirts, ensuring that you're not getting bitten by the tick, that's very important. Wearing clothing that is impregnated with permethrin, which can prevent the ticks from biting, as well as using insect repellents like DEET-containing products, which also, again, help prevent the ticks from biting you.
And you also have to remember your kids and your pets as well, because sometimes even your pets can track those bugs in the house.
Yeah, and as the poppy seed example showed, the bugs can be very small. I mean, almost microscopic, to the point that you're not really looking for them. They can be stuck in places where you're not looking, in your hair, behind your ears, on your back where you can't really look well. So all of those are challenges. The CDC recommends taking a shower after you've been outside, so that sometimes it may not wash off all the ticks, but it can at least help you rinse off a few that haven't attached yet.
And now with this possible case of the bourbon virus in St. Louis County, this is such important information. So Dr. Patel, thank you so much for joining us.
Absolutely.
Great to have you here this afternoon.